All right. Well, welcome everybody to the February meeting of the Advisory Council on Public Health. Excited about today's meeting. We have a lot of good things to cover, and I know we have a number of members of the public who would like to make public comment, and we'll be able to do that in just a minute. So maybe we'll just start out. We do have a quorum, so this is great. Maybe we'll just start out and John, see if there are any announcements.
I don't have anything in particular. I think everything from the department's perspective is covered in the director's report, which we'll talk about later. I actually know one. We have an opening on ACPH that we're still looking.
Yes.
I think that's important to highlight for
Still
everybody.
looking. So if anybody knows anybody who would be interested, you would think in our community with all the health professionals that we wouldn't have anything. So we should continue our efforts. And I also need to produce a report for the select board this month on our activities for the past year. If anyone has any particular items they'd like me to highlight or emphasize, please. So we will start out our meeting with public comment. We do have a number of members of the public who'd like to make comment. Let me just quickly go over what some of the rules are for public comment. We will call on people on the order by which they have signed up. So Chloe will be calling people. If your name is called or when your name is called, please, ideally you don't have to, but we'd always prefer it if you turn your camera on. We do ask that you identify where you're from. If you're within Brookline, either your street address or your precinct. If you're not from Brookline, just what town, state and town you're from would be great. Because we do have a number of people who'd like to present, each person is limited to 3 minutes, and we'll be timing and we'll be asking you to stop at 3 minutes. Maybe we'll even try to give you a warning 30 seconds before that if we can do that. We will not be having discussion based on the comments. We'll just be gathering these comments for us to consider. Many of you are talking about issues related to Kratom, which we will be, during the course of the meeting, updating on the status of that regulation, but we will not be having an extensive conversation about that today. We will be having a more extensive conversation in a sort of more of a public hearing on that when the regulation is ready for a more active discussion. But with that, Chloe, please let us know who's up first.
So it looks like we do have a list of people who pre-signed up, but I also see some names that are not on our list, but are free to share public comment as well. So we can start with the list I have first. Is there a Shannon Harold? Okay, I have Wendy Chamberlain, if you'd like to say public comment.
Yep, I'm here. Oh, sorry, go ahead.
Okay, we have a timer for 3 minutes. You may begin.
Okay, hi, it's Shannon, I'm sorry. So we're allowed to public speak about Kratom, right, you said?
Yes.
Okay. Good evening, board members. My name is Shannon. I'm a lifelong resident of Massachusetts. I just wanted to express my deep concern regarding a potential ban on natural whole leaf Kratom. There are a lot of chronic pain patients like myself right here in Mass that are terrified to know people will suffer in pain if natural Kratom is totally banned. As a healthcare worker, before discovering in 2017 natural whole leaf Kratom, I suffered chronic lower back pain. I am now able to work pain-free because of natural Kratom. Please, instead of banning natural whole leaf Kratom, I respectfully request that the board consider regulation. I also want to add our neighboring state, Rhode Island, banned Kratom in 2017. Scientific research was done and they reversed the ban on Kratom as of April 1st, 2026. The FDA announced in their July 29, 2025 press conference that they are not interested in scheduling Kratom. They only want to ban synthetic 7-OH. South Hadley just passed a regulation on natural leaf Kratom and are banning 7-OH. And just recently, Amherst, just last week, they also voted to regulate and not ban. Thank you so much for allowing me to speak.
Thank you.
Thank you.
Okay. The next person we have is Wendy Chamberlain.
Hi, can you hear me?
Yes.
Yes, we
My
can.
name, okay. My name is Wendy Chamberlain, and I'm a mother, and I'm here because of my son Joseph is dead. Joseph did not struggle with illegal drugs. He did not overdose on fentanyl or heroin. He used kratom, a whole leaf natural powder. Specifically, its primary alkaloids, metragenine and 7-OH. Products that are sold openly, marketed as safe, and completely unregulated. My son died from a metragenine toxicity that he consumed for energy. After his death, I did what grieving parents do when the system fails them. I started asking questions. I learned that kratom products are very widely in potency, that newer extracts are far stronger than what users believe they are taking, in that there is no federal oversight, no dosing standards, and no warning labels that reflect real risk. I now serve as the founder and chair of Kratom Danger Awareness, a nonprofit, and I represent thousands of families across the country, parents who have buried children, spouses who have lost partners, and families living through addiction that began with a product sold as natural and safe. This is not speculation. This is not an antidote. In 2025, the Drug Enforcement Administration formally accepted our citizens' petition requesting that the scheduling of metragenine and 7-OH, that acceptance means the federal government determined there is enough scientific and medical concern to warrant a full review under the Controlled Substances Act. And that matters because it confirms what families like mine have been saying for years. These substances are not harmless supplements. They are psychoactive compounds with real risks, risks that communities like yours are now being forced to manage on the ground. Local action matters when federal action lags. You have the opportunity to put public health first to protect families and to prevent more parents from standing where I stand today. I am not here because I want to be. I'm here because my son cannot be. Please act before more families join ours. Thank you for allowing me to speak.
Thank you very much. Appreciate it, and sorry for your loss. For future speakers, please do identify where you're from, both town and state, if you're not from Pembroke. Thank you.
Okay, our next speaker would be Shane Maciel. Shane, would you like to leave public comment? Okay, that's the rest of my list. So I would ask to please raise your hand on Zoom if you'd like to leave public comment. Yes, Dan Gibbs.
I apologize. Hello?
Hi, yes, Dan, you may go.
I think that's Shane.
Oh, sorry.
I'm sorry about that. I was on mute.
No worries.
I apologize. My name is Shane. I'm calling from Medford, Mass. And I'm calling just to promote the regulation of raw leaf kratom. I do understand there's a lot of speculation out there regarding raw leaf kratom and its safety. However, there's generations of studies that prove the safety of raw leaf kratom versus what's going on right now. There's this abundance of a synthetic material called 7-OH, which has really created a mass hysteria of concern around kratom because it's being posed as a kratom product when in fact it's just using a very minute piece of kratom and then manipulating it through synthetic processes, which no longer make it a kratom product at all. And these are what's causing this issue of the stories of these deaths that you're hearing. And there's a lot of states that are following a Kratom Protection Act that I wish that Brookline would maybe consider looking into it. Regulations around age, proper proper licensing, proper I can't think of the word right now. I'm sorry, I got caught off by being on mute. But again, I just appreciate your your time for allowing me to speak. I do think that there's a lot of science behind raw leaf kratom versus what we're hearing out there, and how a lot of these other agencies that are being funded are often funded by doctors who are providing Suboxones or Subutex, which create actually a harder drug to get off of versus these harm reduction uses that kratom's being used for, as well as chronic pain that it's being used for, mood enhancement. There's a lot of things. It's not just about substance abuse. So I really appreciate the time. I thank you. I'm sorry that I got caught off guard, but I do thank you again.
Okay, thank you very much for your comment.
Okay, Dan Gibbs.
Yes, hello. My name is Dan Gibbs. I am from Columbus, Ohio. Just recently, the Board of Pharmacy in Ohio did an emergency ban for 7-OH and all synthetics. They're also doing emergency rulemaking to ban mitragynine in its in all forms. That is in the rulemaking process right now. I'm here as a parent who lost a child to kratom toxicity. My son Austin died after using kratom leaf products containing mitragynine. His toxicology did not show illicit opioids or alkaloid concentrated formulations. His death was ruled consistent with kratom toxicity. His use was not prolonged or extreme. This was not misuse. It was exposure to a product marketed as natural and sold without medical oversight. I submitted written materials to the board earlier today, including an executive brief and first-person user accounts. I want to be very clear about one point that often gets buried in these discussions. None of the evidence I submitted involves 7-OH or newer extract products. The harms documented, addiction, severe withdrawal, medical distress, and relapse, all involve kratom leaf powder or mitragynine-only exposure. Many of these cases predate the emergence of 7-OH in its entirety. This matters because it shows the risk is not limited to newer formulations. The risk is inherent to kratom itself, the same products that have been marketed for years as safe or traditional. I also want to address regulation. Labeling and manufacturing rules do not prevent addiction, withdrawal, emergency medical presentation, or death. Regulatory frameworks normalize availability while leaving individuals to self-manage dependence and withdrawal without medical supervision. From a public health perspective, the evidence supports prohibition, not regulation. I respectfully ask the town of Brookline to treat kratom as a public health hazard, not a consumer product, and to include the materials I submitted in the official record. Thank you for your time.
Thank you very much, Mr. Gibbs. Appreciate your testimony.
Okay, Venus.
Hi, can you hear me?
Yes.
Okay. Good evening, members of the committee. My name is Venus Usher, and I'm here to urge you to keep plain leaf kratom legal and regulated, not just for me, but for countless others who rely on it safely every day. In 2000, my life was turned upside down by an FDA-approved medication that caused kidney stones and constant pain. For 17 years, I fought to prove my pain was real. I was labeled a drug addict, sent to rehab, and even underwent unnecessary surgeries, including a hysterectomy. No one believed me and no one would help. And I'm from Newcastle, Delaware. I don't know if I said that or not. So I want to make sure you know that. Then 8.5 years ago, I discovered plain leaf kratom, a simple tea that changed everything. I didn't expect much, but the relief was immediate, better than anything I'd experienced in 2 decades. It allowed me to finally undergo a 3-hour surgery that proved my pain was real. Even afterwards, plain leaf kratom, not prescription medicine, helped me heal, even still in the hospital. I had them remove my IV, I drank my tea, and it worked better. I got out of bed and reclaimed my life. Since then, plain leaf kratom and cannabis have been my only source of pain relief. I don't crave it or chase a high. I'm clear-minded, functional, and present in my life again, as a nana, a mother, a daughter, a wife, and a friend. This is the truth. Unadulterated plain leaf kratom is just crushed leaf. It has a natural safety limit. If you take too much, you don't die. You simply throw it up. It doesn't depress the respiratory system or cause fatal overdoses. And science shows that. Responsible use is the key. Plain leaf kratom consumers are everyday people, quietly living their lives. We are not looking for trouble, we're making memories, and many aren't even aware of the bans. Sadly, that's how people like Marshall Price, who received 10 years and was murdered in prison, and Shayna Brown, who is facing 10 years to life, became victims of kratom criminalization. Please pay attention to who wants it banned. It's often those who profit when kratom isn't available, pain clinics, rehab centers, and others tied to the system that fail patients like me. I ask you to look at the facts and the faces of the people that it helps. Keep plain leaf kratom legal and regulated, protect those seeking release, not punishment, and let's save lives, not ruin them. Thank you so much for listening to my story, and you have a nice evening.
Thank you so much for your testimony. Appreciate it.
Okay, Susan?
Yes. Can you hear me?
Yes.
Yes, my name is Susan Eppard, and I support banning all forms of kratom because my son, Matthew Eller, died at 22 years old from whole leaf kratom powder, which is the least potent form of kratom available in the United States. It caused him to have a seizure and to go into cardiac arrest and die, and was unable to be resuscitated despite extensive efforts. And his toxicology showed that he died from the toxic effects of metragenine. It's an alkaloid found only in kratom. He had no prescription drugs, no street drugs, nor alcohol in his system when he died, and his autopsy showed he had no underlying health conditions. And it's very important to note that my son did not die from 7-OH or 7-hydroxymetragenine, because my son died in 2021 and 7-hydroxymetragenine didn't hit the US market until late 2023. And it's also important to note that the FDA has not changed their stance on kratom. They actually are interviewing everybody, including myself and many others, in a group that I'm in called Kratom Danger Awareness. And they're doing extensive research on all the kratom products that have killed people. And they in no way have changed their stance on kratom. And if you look at their website, it will say exactly that. And they will maybe try to dupe you into believing that the FDA has changed their stance on kratom and saying it's safe because of some ascending dose study, but that is completely false. And if they needed to, they could obviously change their website to reflect that if they believed that. So please don't let other people die, because every time another person dies, this rips my heart all open again. Just please ban all forms of kratom. Thank you.
Thank you so much for your testimony. Appreciate it. We have
Okay.
one more.
Yes, it looks like iPhone 245.
Hi, I'm sorry, can you hear me?
Yes.
Hello, my name is Holly Truval, and I am from Lowell, Drake, Mass, and I am writing to you, and I'm not writing, I'm speaking to you, hoping to support a ban on kratom. I've been a teacher here for the last 20 years, and I lost my only child, Tyrell, my 25-year-old son, to solely metragenine toxicity on February 6, 2024. He died just from drinking a kratom seltzer drink that was marketed as alcohol-free, caffeine-free, and sugar-free. It was a sole cause of death on the death certificate I sent you. No secondary causes, no underlying health issues, enrolled solely just as an accident. To say the last 2 years have been nightmares, putting it mildly. Suffered immeasurable pain and heartache no one can comprehend besides another who have lost their child. Many kratom advocates say people don't really die from metragenine toxicity, even though the death certificate may state it. They say they probably had other things in their system. That may be true for some, and that in and of itself should be most concerning for the public and a health doctor or advisor or board member. Due to there being no federal regulations, oversight, nor FDA approval, we don't know if mixing anything with kratom, even something such as Benadryl or prescription medicine, will give us an adverse effect. Medicine, there's not enough information known to say how much could be taken to prevent. There's no labeling. There are also no dosage recommendations on any of these packages. So when you're talking about selling kratom to uninformed customers, people who are looking for help in selling, trusting sellers to do the right thing, that is not always happening. That is why the FDA continues to not approve it. There are too many unknowns. And to regulate under 21 is moot because the majority of deaths, 99% of the deaths, are men between the ages of 21 and 40. That is factual. That is not just me saying that. Also, The more mitragynine you take, the more it breaks down into 7-OH inside your body. So as that gets you addicted, the more you have in your body. I have worked tirelessly to help ban kratom throughout Mass. To date, we have almost 14 towns that have solely banned kratom. The one mentioned earlier were just 2 towns recently that just did regulation, but the other 14 spoke, and you should watch those. The chief of police spoke at Bourne. He urged it to be banned. A nurse in Plymouth and in Northampton urged it to be banned. I'm just hoping the rest of the Massachusetts Board of Health see we're not doing this. I don't want to relive my son's death every single week when I come to talk to these meetings. We're not making anything off of this. You can't take anything more from me than I've already lost. I just want to say, in closing, that autopsies don't lie. Death certificates do not lie. Kratom killed my son, and it was just the mitragynine, not the 7-OH. Thank you for your time.
Thank you. Thank you all very much. Are there any other people who wish to speak? Seeing no hands raised, we will close the period of public comment. And again, I want to thank everyone who spoke this evening. All your information and materials you've sent are in our records. I know many of us have already read them. We will certainly read them again. And again, we'll be reviewing the issue of kratom. We're going to briefly update on the status of those regulations, proposed regulations today, but we'll be having a much more extensive conversation about it in one of our future meetings. Either I can't tell you whether it's next month or the month thereafter, but we will post information. So thank you.
Thank you.
Good. All right, just moving then on to our regular business. The next item on the agenda is just the more mundane approval of the minutes. Do we have any motion to move minutes from last meeting? Jim?
Well written.
Good. Yeah, they were good.
Second.
Rosemary seconds. Good. All in favor?
Yay.
Good. Any opposed? No. Good. So they approved. Good. Next, John, could you give us an update, whoever would, on the
Yes.
Be Well Health Stations?
I would be happy to. So since our last meeting, yes, I had a presentation, and I was lucky enough to have our chair at that meeting as well on the 13th to provide some public comment to the select board. Essentially did the same version of the presentation I did for all of you in January with the select board, and then answered any other questions. There weren't a lot of surprises. I think some of the questions and concerns they have were to be expected. So it was a really good dialogue. Really appreciated the time that they gave us. Went back on the 27th. There were no additional questions from them, and they voted unanimously to support Be Well Health Stations. So that is step one. That week, I also reached out to our new library director, Jill Mercurio. We had a great conversation that week, and what I said to her, and I think that it's important that the community hear this as well, is that really was step one for us. I was advised by the town administrator to start with the select board, get the kind of overall support of the town, and then make our way over to the library and the board of trustees, and then ask for their support. So that will be the next step for us. Either Darlene or myself or both of us will go to the board of trustees next month and do a presentation and have a discussion with them.
That's the library board. Right?
That's the library board. But the library director is very supportive, very excited. She comes to us from Newton, and in Newton, she was very supportive and partnered with the public health department over there often, including with the naloxone boxes. They have, similar to us, they have naloxone boxes in a lot of their public buildings. And we've got a great relationship with the commissioner over in Newton, and she said to me they were the first ones to sign up when we got those boxes and wanted the trainings. And so great early partnership. And so we're grateful to Jill and to the library staff who have provided us kind of initial feedback and perspective. And so we'll carry that work forward and hope to have those health stations up and running in the next 2 months.
Anthony.
I think this is a great idea. I know I think, John, you were there a year or two, no, probably 2 to 3 years ago when we talked about this idea potentially in ways to address some of the concern with contraception and access at one point. One of the things I do wonder about is there the potential for not additional products, but use of like QR codes to help communicate to the public about some of the issues that we're facing, in public health and medically in terms of potential loss of insurance and access to good clinical information for things like immunizations? Could there be a QR code that is on the actual dispensing machine that links directly to our website or routes them to, for example, how to get access to public, like Mass Connect in terms of insurance choices, or even the Shine program for elderly in terms of thinking about Medicare, or to our Brookline Public Health website for access to other things, because these are areas where the general population of our town is going to pass, and even a QR code doesn't really cost us anything.
Yes, so as part of the contract with the vendor, we are allowed to put a skin over the machine, and so we have complete control over the kind of the visual outside of the boxes themselves. And so Darlene and I will be working with Christina Metcalf on kind of the marketing and the launch of these, and part of that will be what are the messages, what's the branding we want on the machines, and what are the graphics, and there will certainly be QR codes to additional information. So it could be the health department website, and it will probably also include some messaging around our human service navigator and the resource page, which will, I think, capture, Anthony, some of those specifics as well. So yes, the specifics haven't been worked out yet, but that's sort of the framework that we're starting from with these. And
preferably if the languages also could be targeted or be directed towards the more common languages in Brookline, which I don't know how high Spanish is, but things like Russian or things like that potentially on there too, that I think would be helpful. Because again, I think people who have alternate languages are probably the ones that are going to be more susceptible to needing some of these things and being able to get access, when there isn't someone there readily able to tell them what it is.
It's a great point. The machines themselves, the screen interface translates into dozens of languages. So we've already confirmed that our most common are covered. I think just about all of them are covered, frankly, at this point. And then as it relates to the web materials, we'll make sure that we work with language access so that they're in all the necessary languages. In fact, the language access coordinator and I just had a meeting 2 weeks ago now, because the policy, they're getting ready to really fully implement the policy. So he's been working really hard on kind of the workflows for language access.
If all goes well, what's the timing for this to be installed and up live and stuff like that? Assuming the library trustees say.
Yeah, the two pieces are speaking with the board of trustees. We were supposed to do that this week, and they asked us to come next month, which is fine. In the meantime, now that we're through the select board, I think we'll be working with the facilities and building department to try to figure out the logistics around, do we need to get a concrete pad placed there, or can we bolt them right to the existing, cement or stone surfaces? And then electrical. That's the only other barrier, is making sure that we have electrical access, which is the whole reason we opted for the public buildings and not kind of out on the street, which is our initial plan, was to do these out on sidewalks, and getting electrical to a sidewalk is a little bit more difficult. So,
they have turkeys in front of most of the libraries.
They do.
Oh, maybe you could move the turkey in, but anyway, put it on electric. Sorry.
Yeah, so we'll be doing that work over the next month. We'll meet with the board of trustees of the library in early March, and then my expectation is the vendor we're using, I think, needs 40 days lead time. So then that puts us into probably early May before these are on the ground. But we will certainly keep you all updated as those timelines get clearer.
I mean, everyone I've mentioned this to has just been tremendously excited about it.
Very nice.
I've mentioned it. Just universally positive feedback.
We're thrilled. Yeah, that's great to hear. I don't know if I mentioned this in the presentation or if this info came in after. I did talk to Somerville, who launched these a few months ago, and they've had a great reception. About 40% of the materials are being taken from the machines after regular business hours. And they have seen an initial uptick in what they anticipated as far as people using the machines, which was really exciting for them. So we're going to continue collaborating with them and learning from them before we launch.
John, do they put theirs in front of libraries also?
One is in front of the library and one is in front of or near their food pantry. And they did say that they are seeing different demographics depending on the two locations. And so they are adjusting some of the materials that are in the vending machines based on those populations. So one of them, I can't remember which, they're seeing younger population and population with young children. And so they're providing some diapers and other resources because that's what those communities need. So the machines themselves allow us to do some data collection. So we can put some survey questions on the machine. They're not required. Somerville said about 50 or 60% of people are actually answering the questions. Sure. So they are getting some data that way. And then we'll have a QR code for a more robust survey for those that want to provide feedback. Maybe they have some suggestions on items that we want to include.
Great. All right, well, let's move on to discussion of policy and where we are in this variety of policies and regulations that we're working on.
Yes. So I think the broader thing that you should all be aware is we've got a lot of great work coming out of Town Council's office. We've kind of figured out the path forward, and we are working with Jonathan Simpson on each of these revisions. And so he has reviewed the kratom and the synthetic cannabinoids. He has also previously reviewed keeping of animals, so I put that back on everyone's radar. He took a brief look at tobacco control. We'll talk about that in a second. So these were in, I don't want to say no particular order. I thought kratom might go first, given we've seen some data and there have been some deaths with kratom. In Massachusetts, we're seeing between 20 and 30 deaths per year that are kratom-associated deaths. That's statewide. Yeah. And so given that, I felt a little bit of an urgency to really dig into this one. And then I plan to bring synthetic cannabinoids back and then keeping of animals. Tobacco control I left for last because we have a bylaw and we have a potential regulation. And the outstanding question for town council is, do we ask town meeting to revise the existing bylaw to include the additional new language that came out of the revised model reg? Do we create a regulation that just touches upon the new items, or do we do a regulation that incorporates the whole regulation and then ask town meeting to rescind the original bylaw? I haven't got an answer from town council on their perspective. It's a little complicated. So that's why that one is kind of last on the list right now, and that could certainly change.
Anthony.
So just my brief experience so far as someone who has been speaking about nicotine-free generation in like 20-something towns and has 3 more lined up in the next couple of weeks. This is well within the Board of Health's purview, and I would encourage it to be a Board of Health action versus town meeting. What we are seeing happen, and it's likely to happen, is it will truthfully come down to those of us who need to provide education to town meeting members to have to offset the potential advertisements and lobbying that will be mounted by tobacco lobbyists in this town. In the previous couple of times, and I don't remember if Charlie, you remember this, when I did the flavor one, we all got these like postcards in the mail about the law. And I worry that there's deception going on by tobacco lobbyists, and they will try and do the same with this potentially. And I think it'll just add confusion and could potentially lead to a negative outcome just because of confusion. So again, this is well within the Board of Health's purview. It's what we are seeing other towns doing is when they're doing nicotine-free generation, they are putting in nicotine pouches, restructuring their fine structure, everything to do it all at once as a Board of Health action. That is what the most recent state judicial court ruling said. This is clearly within the Board of Health's purview, and I would encourage us to think about that approach, or be prepared to really make sure we educate the, whatever it is, 225 or 240 town meeting members about just exactly what this action means. and prepare them for the potential that they might get calls from the public because the lobbying group is going to choose the top 5,000 voters and hit them with postcards.
Anthony, do we need to rescind the existing bylaw? Clearly, these additional items on the regulations seem to me to be regulations, and there's, in my view, I agree with you, we don't want to go through the process of town meeting. Do you think, again, given what exists, including the tobacco-free components already in bylaw, do you think those need to be rescinded and replaced, or just add on kind of the newer elements?
So this is a little bit beyond my understanding of like legally, like how to do it. Do you have to rescind it or do you just type it in? This kind of language I'm not necessarily certain of. I know it's model policy now. And so I don't know if that just means use the model policy and do this. I will say this, even the idea of nicotine-free generation potentially could have been thought of as something that could have been done under Board of Health. Definitely the flavor ban that we did at the town meeting could have been done under Board of Health. At that time, it was just we had leadership that was less than excited about any type of tobacco control. So this is just something that follows that path. I think this is something I can ask Mark Gottlieb and PHAI if the correct definition of it. But my understanding is again, working with town legal staff, we should be able to do this. It doesn't need to be this idea of like going to a vote for rescinding. How the language is done, I can ask if we're calling it rescinding or if we're just saying, okay, here's our updated guideline and this is what we're using.
Thank you.
What are your thoughts about that, John? I mean, I think and this predates me, right? I think Segal was working on this too. Moving towards a model where we we create regulations is just far more efficient and far faster.
Yeah.
I am sympathetic to exactly what Anthony was just talking about and what he shared, I think, back in October when we first started reviewing these, which is leadership changes happen from time to time, sometimes more expected than others, and that you never know. Segal was supportive of regulations. I'm supportive of regulations. We don't know who comes after me, and so I'd hate to rescind and put a regulation in place, and then, heaven forbid, somebody comes in and says, you know what, I don't like this anymore, and then with the strike of a pen and a posting in a newspaper, 48 hours later, it's gone, right? I don't think that would happen, but I think we just have to recognize that Board of Health can move on, right? That's the benefit of the regulations, that the Board of Health can act much more quickly. We need a public hearing, we would do that here, we would get community feedback, but it certainly can happen more frequently than town meeting currently meets. So that's my preference, would be to put it in as a regulation. Good. And the model policies are very similar, right? Anthony says the bylaw that exists is the old model policy. What we're proposing is just the new revised model policy. So you can see it in the track changes. It's just chunks of text that they have added. It's pretty clean. And so it may be that through regulation, we just say we're going to add to these lines this text. And I think that would be the most efficient and cleanest way to do it. We just got to make sure that that's legally allowed.
And I think the harder thing that complicates things a little bit for Brookline is we actually, if you think about it, did it the other way because we passed nicotine-free generation. And so a lot of the language that we have to be careful of around like fine structures and things like that is to make sure that it still fits with the fact that we already have nicotine-free generation in there. Most of the 350 towns that are going to be doing some type of if they're addressing this, they're actually going the other way, right? Nicotine-free generation is the heavier lift because the model regs now have a lot of things, around like the vending machines, fine structure, ages, and pouches. And so I think that's the only thing to be careful of is already our languages state nicotine-free generation. So we just have to be careful that for things like the fine structure, it's still clear, like, where we're following.
That's a great point. I made a note, we'll double check that. So that's the tobacco control. Kratom, I think the hold up in this moment, so we've got our revisions back from town council. I don't think there wasn't many, but in the meantime, we've now received word that MAHB has drafted a model regulation. And there are some communities looking at it. So there's a training coming up next month, at the beginning of the month. I think it's on March 4th that I was planning to attend. In the meantime, I'll be reaching directly out to MAHB to get access to that model reg, and then we can compare it to what other towns have already passed.
MAHP.
Mass Association of Health Boards. Sorry, there's lots of acronyms. Yeah.
John, if I could clarify one thing, just because there
Sure.
are out of town or people who might not have regularly attended the other meetings. I believe the regulations that I put forth, like the drafts I'd sent in, were for synthetic. Now what the board chooses to do, what the council chooses to do in general is a separate discussion, but I just looked back when the speaker spoke. Because it seems like there was consent, and I did not pull any of these speakers that came in today, but it seemed like there was consensus around synthetic. Like synthetic does not seem to be the one that anyone is interested in. And so when I looked at the policies that I had turned over as potential draft, and even kind of like what my slide set went over, a lot of it was around, again, the discussion around synthetic. Just to kind of make sure we're clear. Now, if we decide to go, for natural and things like that, that again is a discussion, but I was just looking back just to make sure that it was kind of clear, like what the initial drafts had.
That's a great point. And I think I gotta go back and look, Anthony, but there were two. There was the kratom specific that you had worked on, and then there was the synthetic cannabinoids that might have also included kratom. It's been a minute since I've looked at that specific one.
Yeah, so
But
I think the language had both included in the policy, because a lot of places have done kratom and synthetic cannabinoids, but my presentation and the slide deck and my original intent was around synthetic kratom. But a lot of the other municipalities, I think the two major samples that I turned in also included synthetic cannabinoids, because of much same thing in terms of the worry about like what is the intent of it in terms of like potency and toxicity.
We are not discussing this today till we have seen the revised draft. Is that correct?
That's right. Yeah, so there will be no action on this. My preference is to wait until we see that model policy, that I get that to everyone so we can all take a look at it, compare it to what we've already drafted, and then take action at that point.
Either next month or the month thereafter.
We may be ready for March. I think
Yeah.
it depends on, and I'll probably learn a lot more in the meantime. And other communities and some of the people who spoke at Open Mic talked about this. Other communities have been taking action, even since the last time we discussed this. So I think there's a lot that's been learned over the past 6 months.
And the spectrum continues to be the same. Washington State, and this morning in my news collator thing, Utah is now taking action. I think a couple of the speakers alluded to kind of like a consumer protection type of template, and both of those seem to be building on that synthetic is definitely going to be included. And some of the other questions are things that may not necessarily impact us as a municipality, that are kind of state level, but Utah and Washington State, again, to show that this just has broad support across the spectrum, are on there. One other thing, John, if they talk about any other things, if you remember at the presentation, one of the things I pointed out is that it's getting more and more difficult, that this is whack-a-mole, right? Like I had just heard about gas station heroin, and I've not had the chance to read about that. So if the MHAB template policy will include some of these other things, that would be helpful to know, because I have a CE talk for pharmacists saved from November that I have yet to attend to learn more about gas station heroin. But certainly as we work on kratom, there are these other types of products that are similarly kind of like not filling in the gaps, but are making it hard to just keep up with what can impact the general health of people.
What is gas station heroin?
I have not even had the chance to like pull it up, other than that. I intend to in the next few weeks to try and watch the CE and see what it's about. I suspect it's something similar in terms of like this kind of synthetic thing that might be used for pain.
Tianeptine? TIANEPTINE. Yeah, that's helpful. That's yet another one for us to keep up as possible. So that's, yeah, so my expectation is at next month's meeting, we will have a more robust discussion on kratom based on what we learned from MAHB and the other proposed regulations or template regulations.
And the sport animals, when will we, what's the?
Roland and I talked about that last week. I know, so you all saw that months ago. So Roland and I are both reviewing Jonathan Simpson's comments right now. So that one, given that it's been sitting for several months, I told Jonathan we'll move that up to higher up on the list. So we just need to get through his comments and meet with him. There's some that are going to require some discussion, and then we'll bring that back to you all. Could happen in March if Roland and I can find enough time to get through it together. Great. So that was just me holding us accountable and saying, yep, that one's been sitting around. And then I put Springtown meeting on there just because I haven't heard anything. No one's come to me proposing anything for the warrant, but didn't know if anyone else had heard anything at this point or.
I mean, there will be housing issues as always, so, you know, there's a big proposed development out on, it's called Chestnut Hill West, or the Chestnut Hill Commercial Development. Across the street from that street, there's a large proposed development out there with some rezoning that the select board may bring to town meeting. Some of us hope that the select board will allow it to go forward to town meeting. It's great. Meeting tomorrow. And there will be other housing ones, but I don't know about it. There may be some on sort of immigrant rights kind of issues, I guess. Talked to some people who said they were thinking of doing something similar to the women's health one, where there already is good policy, and this would be sort of please support the policy. That's all that I've heard of so far. Of course, the main issue in town, budget. Which we'll discuss next month as well.
That's my hope. Yeah. Yes, we will be talking about our department's budget at next month's.
Good.
It's a good segue.
Good segue.
Right into supporting vulnerable populations. So Charlie and I had talked about this, and he had asked for a brief update just on how the current federal enforcement efforts are impacting local public health. You will not be surprised to know that they are, in fact, making it more challenging for all of us, from public health nursing to community health, human services, kind of across the board. There are those in the community who are far more fearful in the past year than they had been in the past, and are now afraid to even sign up for services for fear that that information will make its way somewhere else. And in addition to that, I think staff have their own concerns about making sure that we are staying on the right side of the law, but being respectful of people's rights to privacy and wanting to be able to provide these services. And so we are doing a couple of different things. We're gonna have to redouble our efforts to reach out to these communities and engage with them. And there's a lot of strategies out there, whether they come to us or we start going to them to provide services, and then some staff training and resources and guidance from town council's office to make sure that we're following the proper procedures. And other departments are working on that as well. So. But I've heard specifically from staff that not even in the past couple of months, as things have really, I think, taken a turn at the national level. Even last year, we were already experiencing some impacts where residents were coming back with some of their, if they were given resources, they'd come back to us and say, we don't want this now, please take our name off your list, type of situation. And so.
Are there ones that are sort of being more commonly rejected or so like that? Do you have a sense of that?
It's not at this point. I can't
it's
say
not
that
the Board of Health, the programs presumably aren't ones like Medicaid where there's some serious risk of data sharing. Is that correct?
There's no data sharing per se between local and federal. I will say that they are starting to put language in all of their federal grants around a lot of these issues, whether it's transgender rights or immigrants or, you know, pick your topic. And they're starting to put requirements in that we follow certain procedures or share data. We obviously won't be participating in anything that violates any of the human rights that we disagree with, or not disagree with, any of the violations of human rights we disagree with. So that's making it challenging for us because we're in this environment now where we're struggling with funding, having this kind of town-wide discussion about what funding needs to look like for town government moving forward. And on top of that, we're losing potential, you know, hundreds of thousands of federal grants or the opportunities to apply for federal grants.
Does the Board of Health currently have much in the way of federal grants?
No. We did participate in an emergency preparedness grant. I don't think we're going to receive that grant as a town. I don't think we're going to receive that grant moving forward. So that will have a small impact on us. It'll have an impact on multiple departments. And then there's some grants that we were hoping to apply for as we try to, you know, strengthen our position as a department. And I think it's going to be much, much harder. And then that means everyone is now moving towards NGOs and other organizations for funding, and those sources are, you know, the competition's going to be far higher. So we're aware, we're preparing for it, we're working to continue to build relationships with those communities and try to continue to provide supports in any way that we can. So we're open to any and all suggestions and feedback. And
how has it affected the, you know, our new initial human services efforts?
It's hard to say for certain because it is new and it happened kind of in the midst of this. I haven't heard anything specifically from Eliza. I know she's thinking a lot about it.
What about our food programs in the summer or now?
Food is one of the ones that was impacted last year. I can't say to what degree, right? Because I think there's two things. There's those who maybe decided to sign up and then tried to rescind, and then there's a whole host of people that we just don't know. Maybe they never signed up. They stayed home and they just. And we don't require a lot on those forms. We try to keep a really low bar. Coming from a household that was low income and had to fill out tons of paperwork as a child, like I know what that's like, and so we try to keep a really low threshold. And so people can give as much or as little as they want and still get those resources. And yet, even with that low bar, we're still finding fear and anxiety for good reason.
And you mentioned the vaccine conversations are.
Yeah, they're definitely ramping up. I'm providing like a lot more education on the vaccines that I provide. A lot of people coming in from other countries have questions of like, oh, well, this is not offered here in my country. Like, why is it offered like into the schools? Why do I have to get it? So I'm doing a lot more of like, well, this is the reasons why. This is and the reasons why, like what it helps protect. I think the hardest part is the misinformation from the federal government. It's like, oh, well, in 6 months, this is not going to be required. It's like, well, no, that's what the federal government saying. States have their own rights to make whatever it is required. So there's just like a little bit of like pushback. A lot of patients I found after they have a conversation with me, they're definitely happy with the education I provide. I make sure I give up the vaccine information sheets to every patient, no matter what it is, and whatever language that they speak, and making sure that they can totally understand. And I do, you know, tell parents that you can withdraw consent at any time, but this is really important that you understand why it's required.
And well then.
Yeah, John, like on the point about like the whole privacy concern, I know on Wednesday we're tied into the Friends of Public Health session as well, and talking about Public Health Week in the first week of April. Maybe a topic such as the right to health and human services and the right to privacy might be something that we can try to engage the general community at that time during their annual like public presentation. I don't know if you. particular speakers that would want to talk to that issue, but it might help just making people more aware of the dilemmas that, you face in terms of people trying to gain access. And you can also perhaps introduce the navigator to the broader Brookline community.
That's a great suggestion. And I think it's worth stating here, like, this is a really complicated issue. It's both very simple and yet very complicated. I think we're not proposing to do anything that's illegal, but like public health doesn't care about your immigration status, right? Care about people.
Right.
It's the same discussion we had during COVID. Like COVID didn't care about borders.
Right.
That's why we worked on a regional and a national level, because that's the most impactful way to do things. And even, above and beyond, you might have legal immigration status, and yet there are challenges for those communities as well right now. And I think they're just as afraid as others. And it's really tough. So I appreciate the staff have really been thinking about it and pushing to try to find some solutions. So grateful to all of them and their work.
Do you have good sources of information you can share with families or individual sheets on measles and so forth, things like that?
Oh yeah, so I legally have to give the vaccine information sheets, which gives like what it is, what it protects, like what the schedule looks like, what the signs and symptoms of any reactions are going to be like. I also
Are those based on CDC or what really based on that?
CDC. But I also always refer them to the American Pediatric Academy because I know that they're a really good resource now. And they're really the I follow both schedules. Like CDC didn't get rid of the old schedule; it's still available. Like American Pediatrics just supplemented and gave like their same schedule. So I follow both, show both, give them all the information from CDC, Pediatrics, and I try to make sure it's in a language that they have.
And the requirement for you to do that is a state requirement or a town requirement? State. That you use the CDC?
So it's federally, I have to get the vaccine information sheets. That's federally. I always offer supplemental information. There is like QR codes on the back of the vaccine information sheets to go to other places too if they have any further questions. So I try to refer them to, and I also have the templates for what the state of Massachusetts requires for like our children's vaccines to go into school, what is required, what the schedule looks like there, and how to make sure you catch up. So I always try to make sure I get a couple different places.
The next ACIP meeting might just throw substantial havoc into that. So we ought to be prepared for what in fact we can and should do should ACIP say that the children's vaccine school required entry stuff is just ridiculous.
And no matter what, I'm still underneath the state of Massachusetts. So my licensure is underneath Massachusetts, so I always follow what Massachusetts says. If Massachusetts says that they're getting rid of something, adding on something, I will have to follow that. So no matter what happens, the only thing I would be worried about is how I can get federally funded vaccines. But I know that the state of Massachusetts is also under, they also have that as a concern, and they're always gonna hopefully try and provide, yeah. So no matter what my licensure is under Massachusetts, I don't care what New Hampshire or Arkansas is doing, I'm gonna be worried about more Massachusetts and following their guidelines.
So it becomes a state responsibility to develop materials that you can use in the context of serious disagreement between the state.
Yep, so I like how the CDC and American Pediatrics have all the information you can have about measles, mumps, rubella, or whatever your disease is, and then the state comes in. This is the reason why, and this is what I have to do for my licensure. I know. I've been. Yeah.
Thank you.
I've been trying. Yeah. Thank goodness. I'm just trying to protect my license and protecting my patients.
Interesting in historic times. It's getting a little exhausting.
Yeah, I mean, they are trying to change state. What's the group that, there's that group that works on, has all this model state regulations. That's certainly trying to go around the country and get rid of school requirements.
Yeah, I did hear they're targeting like 12 states. I don't even know.
We're not.
Yeah.
I think that's difficult as our legislature is. I don't think they're going to be difficult. All right, well, thank you really for the whole staff. But if there are things we can do, let us know. In fairly regular contact with Jessica Chico, I guess, who runs the immigrant, I forget exactly the word, but the subset of ODICR, works on rights. You know, I'm planning for how the town would respond if, in fact, rights were to come into Boston and perhaps include Brooks. When, right, certainly when. Okay. Well, thank you. Next item is just clarifying our calendar.
Yes, so I had sent a draft many moons ago. We talked about it. I had left kind of a blank in September because I wasn't sure about. I want to make sure that we were mindful of all the religious holidays and avoiding any conflict. But I had staff asking about the calendar. It reminded me that we hadn't settled on September. So talked to Charlie really quickly. Proposing September 14th be the addition for the ACPH calendar, but just wanted to give everybody a chance to speak on it, make sure there's no conflicts for them on the 14th of September.
Looked okay for me, right? Anyone else? Good. Okay, I think we're good.
Okay, so we'll add that to the calendar and we will get a final draft out to all of you. I know you have the draft one, sent that out maybe on Friday, but we'll get that change in there, that addition.
Right, and then you put together a really outstanding report. It's a lot of rich information. Does anyone have any items you'd like to highlight as you go through it? Things you haven't mentioned today, and not if any questions from members.
I think I would be remiss if I didn't take up one of Darlene's items on the first page there, the Change is Good diaper drive. So we'll be working with the public libraries again on a second diaper drive that will begin on February 14th and run through the end of the month.
And what kind of publicity? I mean,
she's probably going to make me pop out of another box and thank everybody.
Okay.
No, she's got a robust plan, and I know
to get people to donate diapers.
She's really creative.
Very creative. So she'll be working hard. They did a wonderful job the last time, so we're excited to do another round. Okay, great. I think we covered a lot of the policy. Well, first and foremost, let me just thank the staff because one of the changes we've made is we've started inviting all of the staff into the report to share their own kind of sections, which is why I think you're seeing more and more detail. So they've done a wonderful job. I think the other big one is the Find Help resource. So we have settled on a name, we have settled on a URL, and we are just waiting for some of the back-end logistical stuff to be taken care of.
Great.
Once that URL is ready to go and live, we will be launching hopefully later this month.
So to ask an annoying question,
Sure.
There's a little comment on the guide related to rodents, and just anticipating as the weather warms up that the little critters will be running around and you'll be hearing more about it. So
yes.
Anything there that's just like in process?
It's actually
different. Are we changing getting rid of our electronic zappers and putting in birth control, or I don't know?
So yeah, we are. So the resource that Nicole put together for us, I think will help to clarify for residents kind of the process and really to set expectations about what are the limits to what inspectional services can and can't do as it relates to rodents. I think that'll be helpful for homeowners and for tenants and for residents in general. As it relates to rodent control more broadly, we are having some internal discussions about a better path forward for enforcement and treatment of rat burrows, rodent burrows. So I can't say much more yet, but simply to say that between the town administrator's office, myself, and DPW, we are having some discussions and just exploring other models. What are other communities doing? Is there anything more that we could be doing, or a better way to spend tax dollars, more effective, more efficient way of doing it? So.
Okay, good. We like efficiency, but I'm sure we'll hear more about it as the weather warms up.
We will certainly get specific in the future once we've settled on a
I just had a quick question. I didn't quite understand the issue on what you're doing in the schools around mental health, the behavioral health intervention program. A brief squid there about two interns helping out with 64 students. So I'm intrigued.
Oh, okay, yes. So thank you for calling that out. Yeah, so this is an ongoing program. So many moons ago, we had a grant from the Drug Free Communities Grant. This was probably almost 2 decades ago. And that is when our Substance Use Prevention Coalition started, and we started doing work directly with the high school. That was 2 mental health providers and some interns, and that's sort of been the model right along. And then the funding ran out, we pivoted over to the cannabis tax dollars was funding this program. Now we're using opioid settlement funds and hoping to get drug-free communities sometime in the future. All that said, we still have staff that are in the high school that are public health staff, and they manage the diversion program. So the student gets caught vaping in a bathroom, or a parent is concerned that maybe they're using substances or catches them using substances. These are 2 staff and 2 or 3 interns depending on the year, and they run the diversion program. So they meet with them between 4 and 6 times throughout the school year and kind of talk to them about their substance use and try to get them resources. If they want more support, we kind of.
So 64 kids were involved in this.
So far this year, we are at 64 students for the year, and our 2 interns are doing a lot of that work.
All in the high school.
This is all high school. And we are doing work, BPEN, we do work with parents, and then we do have our peer leaders program, and we are starting to do some work in the middle school. So with like 6th, 7th, and 8th graders to try to get some prevention information down to the lower age groups.
Yeah, that's one of the issues that came up about parent feedback from the survey.
Yeah.
Excellent. All right, are there any other questions or comments? Otherwise, we'll conclude the meeting. Motion to adjourn? All right, very good. Thank you.
Thank you, everyone.
Glenn, enjoy yourself. Stay.
Thank you. Have a good evening.
Don't sit. Thank you. Yeah, you do it tomorrow. Not much.
No,